And let's get more now. We are joined by Andrew Ullman, who is professor of infectious diseases and an MP for the opposition Free Democrats in the German parliament. Welcome to you. I'd like to begin by asking you, because we've all seen the images from the US, from the UK, people who are already getting this vaccine. It's a German vaccine. Why isn't this happening in Germany yet?
Because Germany made up their mind that we want to have a European solution. We want to have a full approval through the EMA in Europe and be sure that we have a European approval as a whole, because I think it's very important that safety over speed is something very important for our population here in Europe and within Germany. And I do approve the proceedings that we go through the EMA without an emergency approval. And on top of that, we have to be very clear, the EMA is hardly ever that fast, possibly approving a new medication or a vaccine.
Okay, so taking the more cautious approach. You're a doctor, as we mentioned. Talk with us about the prioritizations that now need to occur in terms of who gets this vaccine first. How will it be organized?
This is a big challenge, first of all, not only locally by the local governments or the city governments. It is a challenge actually for the whole legislation to be sure that the prioritization is put into law. Because what is very clear, even if we have approval next week, 2 weeks from today, not everybody will get this vaccine, and we have to make sure that especially vulnerable populations like the elderly, beyond 80 or beyond 75, receive the vaccine first, and then the others. And this is a logistical challenge, but also an ethical challenge, and that's why we say from the Free Democrats we need legislation in the German parliament to pass the law with the prioritization of the vaccines, and the vaccine the ruling body within the Robert Koch Institute, the STIKO, passed actually a good paper, prioritizing the people who need the vaccine. And one thing was just missing is easily said than done. We need also some ruling for the handicapped, because people with trisomy 21 were missed in the prioritization, and they need to be added to the list as well.
Talk with us a little bit more about the ethics, because, I mean, this is a really fascinating aspect of this. And a lot of people will be asking questions in terms of, who is indeed being prioritized. How do you suggest that things proceed now going forward in order to make sure that that runs smoothly and fairly and ethically?
Well, first of all, we have to define aims that we are looking at. What goals do we want? And the goal is very clear. We want to reduce the mortality rate of COVID-19 disease within each country or within Europe. And then you have to look at the numbers, who was affected, especially with COVID-19 infections, and who died. And these are especially the elderly population in our given countries. So if we get the vaccine to those especially vulnerable groups first, then we will reduce the mortality rate. On top of that, we have to think about the morbidity rate as well, the illness, the load of illness that causes a strain on our healthcare systems. To reduce disease is also a very important part. And to that matter, the vaccine trials that were published last week actually demonstrate efficacy in regards to reduction of disease. And the next step would be, of course, how do we protect those, especially healthcare professionals, that are dealing with those patients that have COVID-19. They need the vaccine as well. This is the prioritization route, which we need approval by the society, but as well as by the legislation as well.
Andrew Ullman, professor for infectious diseases and MP of the Liberal Party in the German parliament. Thank you so much.